So fortunate to have the colleagues that you see here visiting Yogaville. So I'll just take a minute to say a little bit about Dean Ornish and his work and the continuing work. He has now had a number of studies to show not only that lifestyle can reverse heart disease and prevent heart disease, but also cancer. And now he's working on a study to show that it can prevent and reverse Alzheimer's. So that's the newest. Now the statistics are that 1 in 10 Americans is doing yoga, and 1 in 3 is considering doing it within a year because they know it's good for them. So there's an Academy of Lifestyle Medicine, which Dr. Ornish helped define, and that is looking at the relationship of lifestyle to health. There's much interest in the medical community. The Smithsonian had an entire conference dedicated to the benefits of yogic lifestyle. What they did was they went into their basement, they took out all the art associated with yoga that they had collected at the Smithsonian, made a beautiful display of it, and it's a book called Yoga, the Art of Transformation. So in my experience, this doesn't take long. It doesn't take long. We had a patient who had chest pain every day for 17 years. In 3 days, he had no more pain and never came back. We had another patient who, in those days, with remote channel changers, weren't everybody having them. He used to watch TV programs he didn't like rather than get up to change the channel because he'd get chest pain. In 2 weeks, he was walking 2 miles with no chest pain. So that's how fast this approach, if you eat foods that flow through the body, you want to stay away from inflammatory foods, hydrogenated oils, inflammatory foods, processed sugars, as well as dense animal-based fats, including dairy products, which are cheese almost as dangerous as red meat, we know now. There's a new book called The Cheese Trap, if you're trapped in the addiction to cheese. What's wonderful about our workshop is a number of our participants are yoga therapists, and they told of their personal journeys, reversing stroke, reversing heart disease, reversing fibromyalgia and other diseases, so personal. So I just want to say that my first experience with Swami Satchidananda was with a yoga class taught by our beloved Swami Cunningham, and it was in the San Francisco IYI, and I was a stressed out medical student. I went to my first class in 1972, and I did deep relaxation at the end of the class, and I said to myself, this is a kind of medicine. And I've been studying it ever since. So I really want to thank you for being the vehicle of Swami Satchidananda's teachings. He talked about a natural life. And I always want to say that that includes loose clothing. It's important to have our fluids to flow. I've been working with Dr. Oz's father-in-law, Dr. Lamole, who he showed that the lymph around the heart could affect whether or not the heart can clear out fatty blockages in our arteries themselves. So, and finally, just to say that happy people stay healthy. There's science that now shows it. And who will be the happiest person? The person who brings happiness to others. So, thank you. Now, Dr. Sarkar.
You heard the Gurudev, and interesting is, I introduced the subject yesterday, the therapeutic yoga, and exactly we talked about it. The first and foremost thing what he said is very important, that Hippocrates, the father of modern medicine, said, I'm not interested about the disease a person has, I'm interested about the person who has the disease. So the concept of yoga today, if you understand, is that it's a philosophy, it's a practice towards self-realization. The health benefit is we call it a maybe byproduct or a good product. It's an outcome of that practice. 196 sutras, 8 limbs. But that health benefits today, we can take it and use in our Western or conventional medicine as an adjunct therapy. And that is called today integrative medicine. So what we integrate, as you heard when I was being introduced, we integrate the science of Western medicine with the wisdom of the traditional system of healing. It is beyond science, it's a wisdom. But what it does to us, what Guruji said, it gives us health. Western medicine is a provider of a health care. You can buy a medication, you can buy a doctor's visit, but the health you have to earn yourself. It is called self-centered. The only person who can heal yourself is the self. So before I finish, just a couple of minutes, I just want to tell you, me, Amrita, Mala, we have gone through the changes and transformation in the Western medical system. Guess what? Let's go back, 15 years back, 3 out of 140 medical schools had a department of integrative medicine. Today, 100 medical schools has a department of integrative medicine. 65 medical school has a program for training integrative medicine. 25 programs are called fellowship for integrative medicine. 2014, American Board of Medicine started called the Board of Integrative Medicine. Today, as we're saying, that International Association of Yoga Therapists, the only yoga therapy association almost in the whole wide world, has started your standard accreditation and certification. Before our certification, we started called a grandparenting. Like people like us who have been doing for a long time, we expected 1,500 applicants. Guess what? We had 4,000 applicants. We had 4,000, I think in our group, we have about 5 or 6 certifieds. So that is my 2 cents worth. It is a journey which Amrita, myself, and Mala is going through, and we don't know where it is going. Thank you.
A yoga teacher at the bedside of every hospital patient. That's what I foresee. It's already coming.
I started my yoga practice back in 1971 when it was just a fad and people thought we were kooks and freaks and vegetarianism, what's that? People would serve me iceberg lettuce and a potato for, when they'd invite me over for dinner. And I always had a vision that yoga would expand, especially into medical care. And one of the things that I always taught my cardiac yoga, or I still do teach my cardiac yoga trainees, is that it's not a matter of if this is going to happen into medical care, it's a matter of when. And I really believe so strongly that the when has now arrived. I am so excited about what's happening on the medical yoga front and in hospitals right now and in academia and in research. It's just amazing how this whole concept literally has exploded in the last 20 years, absolutely exploded in every direction. So I just want to take like 30 seconds and share with you some of the things that are happening, particularly at the University of Virginia, which is where I'm affiliated. First of all, we have an integrative health clinic. And just within the last month, one of my colleagues started the pediatric medical yoga clinic, which has been very successful. The first day of the clinic, she texted me and she was like, "It's a success," exclamation point, which I knew it would be. We also were given a grant of about $25 million to start the Contemplative Sciences Center at UVA, and that's been highly successful. All 9 schools in the academic undergraduate arena now have unlimited access to yoga classes, mindfulness classes, meditation classes, anywhere starting from 6 o'clock in the morning all the way up to 10 o'clock at night, where they're still offering yoga classes to all of the students for free. So how exciting is that to have the entire student body be able to access these kinds of things for their health and to relieve stress in their system. And just quickly, a couple more things. We have many research projects going on there around resiliency and compassionate care initiatives. We've got the Mindfulness Clinic. We've got compassionate care initiatives. We've got the Contemplative Sciences Center. I just started within the last year. We formatted professional development courses for physicians and for nurses in medical yoga, where they can get CME credits and CEU credits. And the idea is we're going to parlay these workshops into teacher training programs for health professionals. So, and there's lots more, but that's just kind of a quick nutshell version and picture of some of the really, really exciting initiatives that we're doing at UVA. And just a last statement, if we're doing this at a conservative institution like the University of Virginia, imagine what other university systems and hospitals are going to be doing. So it's a very exciting time, and I invite you all to jump on that bandwagon, because this is the wave of the future. This is what healthcare is going to look like in the future. So, thank you.
Your first question is, how do I let go of fear in my heart?
In yoga, in Sanskrit says, Karo yog, raho nirog. Keep doing a daily practice of yoga. First and foremost thing will happen to you. You will get connected within yourself. The moment you get connected yourself, when you get united in the body, mind, and spirit, first thing goes away is called FEAR. Once the fear is gone, you'll be surprised that what happens to your cardiac function. And just let me give you a simple, it's a joke, when we talk about what happens to the heart when you have a fear. This man had a heart disease. He won $1 million in a lottery. His wife found out. Wife was afraid to tell him because he might get another heart attack. So she went to the church, she went to the father, said, Father, can you help me? Father said, yes, why don't you bring him? So brought him. Father did a little prayer, hold his hand. Father said, what you will do if you win $1 million in a lottery? Coming from the father, he had no fear. So he said, Father, you have been so nice to me, so kind to me, I will give you $100,000 first before I use any money. Guess what happened? Father got a heart attack. And that is the answer to that question.
I just want to say this is a living miracle right here. 15 years post-bypass surgery. And really is a great example of what yoga can do.
Yeah.
And I love the acronym FEAR, false evidence appearing real. In other words, fear is based on we think we need something to be happy from outside, basically. And that's a false need, because we are happiness. And so in yoga, we bring a happy person to life. We don't expect or be afraid that life won't give us what we need to be happy.
So I'll take a little stab at this. Just briefly, from just a practical point of view, I think what needs to happen is for a person to, because, well, let me say this first. Fear is nothing but crystallized thought. It's crystallized, stuck emotion, and it's crystallized thought. So how do you overcome that? How do you get past that? I think first what a person has to do is step back and objectify it a little bit and move it away from a subjective grip on themselves. And we all, for any emotion, whether it's fear or anything else, we have to look at what is tethering the fear in our consciousness. What is it tethered to? And I think that's so important because emotions come in layers. They're always in layers. There's depression. What's underneath depression? It might be rage or anger. What's under the rage and anger? It might be anxiety. What's under the anxiety? Some kind of core belief. So I think we have to find out what that fear is tethered to, because fear is just a generic word. It's just a word. But what is the manifestation of it? We have to get down to the lower levels and find out what is that core belief that's holding the fear hostage. And we have to really, really figure out what is that core belief that someone's holding on to. Is it a fear of abandonment? Is it fear of being betrayed again? Is it fear of not being liked? You have to identify what the fear is before you can move the energy. So that would be my 2 cents worth.
Question number 2. Do you feel using yoga as a therapeutic modality addresses body, mind, and spirit, or focuses mainly on one aspect?
Very simple answer. The practice of yoga is a spiritual practice, period. No question asked. Person starts a yoga practice for a physical reason, but when they enter into therapeutic part yoga therapy and stay in that path, is for a spiritual reason.
The word yoga means the same as the word religion. Religio is the origin of the word religion, to bind back. Yoga, to bind back our individual self or the illusion of our individual soul to the source.
So I'd like to just share a really brief story with you, and that is years ago, I was doing a consult with a person who had a heart attack. He was one of the vice presidents of ExxonMobil Corporation. He had traveled all over the world. He had millions and millions and millions of dollars to his name. He traveled with dignitaries and all sorts of individuals. And there he was in the hospital, lying in bed. And I was talking to him about some of the yoga practices and what might be helpful in his recovery. And as I was sharing some of the ways in which yoga can impact on body, mind, spirit, on health and healing, all of a sudden, this great titan of business started crying. Just tears were just rolling down his face. And he started shaking. And he said, I so wish that I had learned this stuff earlier on. He said, I think it might be too late now. He said, and I have such a deep, deep regret that I didn't do this and learn these things earlier on. So unfortunately, he really was at the end of his life, but he had that moment of waking up. And that in and of itself, right there, that moment of realization that he had was a connection of his spirit and his soul into his consciousness. And that, to me, is really what healing was all about. It wasn't too late for him. It really wasn't, because he woke up in that moment. And that's how yoga can heal. Each moment that we wake up integrates body, mind, spirit, soul. There's no separation. Energy is energy.
This question is addressed to Dr. Sarkar. Do you know if eating fruits and other foods together at the same time is bad, as I have heard? I would like to hear your Ayurvedic perspective.
Ayurveda says that this is in a language probably most of you don't understand. It's called khali pete phal, bhara pete jal. You take fruits, eat fruits in empty stomach, and you drink water after an hour of your main meal. Today, we understand what is the reason for that. Ayurveda says today that you should not be eating fruits with your main meal. Fruits should be eaten separately, preferably as a snack during afternoon, and the fruit should be of all 7 coloring, not only red, not only blue, not only green, all the 7 coloring, and also with the 6 taste. Ayurveda describes 6 taste and a 7 color: astringent, bitter, pungent, salty, sour, sweet, and 7 colors: violet, indigo, blue, green, yellow, orange, red. Today, by Western, before somebody asked me, so what happens? I have to eat fruit with my main meal. What should I do? You eat fruit first. Let a little time go by, then you have a main meal. On the main meal, you eat from light to heavy. Doesn't matter what you eat. Use a light to heavy, following your fruit. Today, if you look at Western medical concept, you will see a lot of medication is saying, all the statins, lot of medication, don't take it with a fruit juice. And the reason is described in Western medicine today. The fruit juice has 2 components or enzymes. One is called your intestinal glycoprotein, which interferes with the absorption of trace elements. Another is called cytochrome P450, which interferes with the digestion of the medication or the nutrient component in the body. So you will know the patient who is taking, say, Coumadin will tell you, don't take this thing. One of them is also, surprisingly, is spinach and some fruits. So Western medical concept is that fruit interferes with the absorption of trace elements and interferes with the metabolism with a lot of other things. So fruit should be eaten separate, and it is clearly stated in Ayurveda that khali pete phal. That means you eat fruit in empty stomach. Thank you.
Sometimes at night, while in the stage of falling asleep, my throat tightens and it feels like someone is choking me. Is this sensation due to the vagus nerve, and how can it be alleviated?
Well, the vagus nerve would do the opposite. It would relax you. And as the body is falling asleep, as we go through the different stages, sometimes you can get the elements of other stages interfering with the smooth transition. So I would say in the case of that person, the remedy would be to do deep relaxation so that you're so relaxed that you can easily fall into the deeper phases of sleep without having this effect.
You'll be surprised if you tell you that other therapy. This is called, actually, the medical term is called a globus hystericus. It is a spasm of the muscles in the upper part. We call it a pharynx, larynx, esophagus. And this is due to, obviously, your sympathetic overdrive. You can call it a stress. So the whole practice of yoga is a relaxation response, activation of parasympathetic tone. We, as a yoga practitioner today, we maintain called a yogic lifestyle. It's called dinacharya. I just wrote a book. The book is here. It's called Three Modalities: Yoga Therapy, Ayurveda, and Western Medicine. Then it says Healthy Convergence. And the most of the chapter is what Gurudev just said. The first thing is a wellness. Then is your daily routine. What happens in the daily routine is that we wake up in the morning, we sit down in a squatting pose called malasana. We sit down like this and we drink a glass of water. When you drink a glass of water, then it causes a lot of physiological phenomena. One is called a initiation of your peristalsis. I've lived with the yogis, I've seen. They take a one gulp at a time. Then they start a process called a gastrocolic reflex. Stretching of the stomach, it causes contraction of the colon. You get a proper bowel elimination. That is a relaxer. That literally eliminates your globus hystericus. Finally, what you do at the end, we do the brushing out teeth, the tongue scraping, we do a jal neti called neti pot. So what the neti pot does, I take the neti pot, put a little water, little salt, non-iodized salt, I put through one nose, guess what? Water doesn't come out through the other nose. Why not? The mucosa in the nose is called like a erectile tissue. Once you are a little excited, it swells, doesn't come out, and irritates. So slowly, if you keep it down, keep your eyes closed, start breathing through your mouth. It may take you 1 week, 2 weeks, 3 weeks, depends on your level of your fear goes away. Water will start coming out. Irritation will be gone. Initially, it will irritate. You will have some burning in your eyes, face. Slowly and slowly will be going away. Then you do the other side. We do a few other things. We blow our nose. We do a little Kapalbhati pranayama. But what it does, it takes out the irritation in the upper part of the gastroesophageal area. So all the tightness, what it causes the symptom, goes away. If you get a reflux disease, when the acid comes up, they get a symptom for the acid like almost like a heart attack. They get a symptom like people have they or sometimes get even like your bronchial asthma because tightness. When you keep doing the jal neti part, all the upper GI symptoms from the spasm goes away. In fact, when the irritation goes away, can you imagine what will happen to us? Nothing bothers me, nothing irritates me anymore. Guess what? What is hypertension? Hypertension is emotional disorder, white coat hypertension. I go to my teenage kid's room, my blood pressure goes high up. Blood pressure comes down when you do a daily Jalneti practice. Nothing bothers you. Your mother-in-law doesn't bother you. Your teenage kids doesn't bother you. That spasm which you are holding it here, the tightness called the globus, it goes away. We have a lot of other things we do, but this is, keep doing. 2 things will change your life completely if you can start doing it. If you're able to sit down in a squatting pose, it'll take some time, called a malasana, and get up without any problem, called sit-rise test, do a tongue scraping, and use neti pot for jalneti. Totally transform your lifestyle towards health and healing.
I just want to add something really quick to that, to this question. From a psychological point of view, I think it would be important to just look at a phenomena called relaxation-induced anxiety, and whether or not going to sleep and relaxing is producing anxiety because of the need to somehow hold on to control or hold on to something and just fear of letting go. So I think there's a psychological angle that someone might want to explore.
And for that, alternate nostril breathing would help too.
I could go on all night listening to you all So next one is kind of fun. Is ozone therapy effective for tumors specifically?
Now that I have no idea.
I have open heart surgery 16 years back. For last 12 years, I have not touched a single pill. But I do a lot of practices which really initiates, activates, called medicine cabinet of the mind. So I am interested to using medicine cabinet of the mind, and I have no answer whether ozone helps in cancer.
Yeah, I don't think there's much scientific evidence. Go on to the next question.
Is headstand an important asana at any age? Or can the benefits be derived by doing other inversions, such as shoulder stand, for older yogis?
What Swami Satchidananda said to me was there are special benefits of headstand. But if you can't really go into the full pose, you can do the beginning stages toward it. Because putting pressure on your crown chakra brings your attention there, and it helps in meditation.
In our practice, I have a lot of people who practices with me, they're here, and each one does a headstand with me. So what it does, the basic physiology is, in my book, I have a whole chapter. In fact, I have a whole chapter, all the stages, 8, how to do it. And let me explain to you 2 phenomena so you will understand. You will understand that what happens to the inversion poses. So here is all the inversion poses in one chapter. The moment you keep your head, this is another yogic concept. If you keep your head below your heart, the pressure inside the intracranial pressure goes high up, pressure inside the eyes goes high up, pressure inside the neck goes high up. But our body is an auto-regulating mechanism. It's called homeostasis. So if you can keep your head down a little longer and longer and longer, the intracranial pressure normalizes, intraocular pressure normalizes, carotid pressure normalizes. When all the pressure normalizes, you develop a effortless breathing. It's called Annamaya Kosha to Pranomaya Kosha. Any imbalance you create in the physical body, it shows up in your breath. So if you don't mind getting up and showing it to you how we start, we'll start doing like a little bit of, we separate our feet, then all of our people will do. They put their hands like this, and slowly they put the head down, and they listen to the body signal. So what is the body signal? Pain and effortless breathing. Slowly and slowly they will come down. They will, at a certain point, they'll be able to come down, able to do this. And when they do this, they stay here, totally effortless. And then in a stages, you'll first sit down in a Vajrasana. Vajrasana called a very powerful relaxer. Then we'll do it. We'll show it to you. If you want to come in the morning, tomorrow I'm doing a class. Come on, I'll show it to you how to do it. But you always do it yourself. You do not have nobody touches you, nobody assists you. You'll be slowly, you'll see, put your head down. When your breathing normalizes, when whole hemodynamic normalizes, your body will go high up and stay high up. Is the other inversion poses will help you? All depends upon if you are able to keep your head below your heart, and this is called your baroreceptor sensitivity. When the pressure in the intracranial pressure goes high up, our body has a receptors called baroreceptors. Baroreceptors get sensitive and it lowers that pressure. Guess what? That's exactly what a beta blocker and ACE inhibitor is doing in my body. Able to put my head down, able to normalize my intracranial pressure with the baroreceptor sensitivity. I was able to get out of this 4 medication. You know, she knows when you have a heart disease, you are hooked to the 4 medication for your life: aspirin, statin, beta blocker, ACE inhibitor. And we're finding it out more and more that this thing helps. But one thing I always do to them, you have to listen to your body's signal, and then if you learned or learning a headstand, doesn't matter what age you are learning, do not share with your Western trained physician. They have no understanding about headstand. They said, you have a 40, they'll kill you. You have a hypertension, kill you. And finally, the last really request, if you know how to do a headstand, do not share in your Facebook page. Your friends will put all the 4-letter words for you. You know, this is really serious. Do it in private and get the benefit out of it.
Although I do want to mention that, everything Dr. Sarkar said is brilliant, obviously, but just to have a cautionary note, there are some contraindications for doing headstands, and, make sure you check that out.
And never strain in any of the poses.
Never let anybody touch you. Do it on your own.
If you strain, you'll lose the benefits.
So one just quick contraindication is if you have cataracts and eye issues. So that has to be corrected.
What is the solution to restless leg syndrome? Any way to overcome this?
Rest leg syndrome is a part of our spastic disorder called your movement disorder, part of what you call a Parkinson disease. And guess what? We do yoga therapy for Parkinson disease. And last Saturday, a week from yesterday, we had the American Parkinson Disease Association conference in Williamsburg. 350 people showed up for that conference. So the same relaxation technique, we are not interested about restless leg syndrome. We're interested globally about the person. It is due to the spasticity, tightness of that human being. And relaxation response is the treatment. And for the restless leg syndrome, I see a lot of restless leg syndrome these days. And my belief is that we just talked about yesterday, my body is like a hardware, mind is a software. My software has a bug, and my body hardware is all the problem. Once you fix the software with the practice of yoga, everything gets cured. A practice of yoga today is called somatopsychic. Somato means your body, psyche is your mind. But the outcome is psychosomatic. And all the disease you can think about, what Amrita, me, and Mala is talking about, called psychosomatic disease. And psychosomatic is the outcome of a practice of yoga.
And Swami Satchidananda said to me, the yoga doctor first looks at diet. So the first thing I would say is eliminate caffeine and sugar and make sure you're eating a really good balanced vegan diet with healthy foods, whole fresh fruit, whole fresh vegetables, whole grains and beans, dal, lentils, green beans, and soy is safe now. We know it's not only doesn't contribute to cancer, it helps prevent cancer. So look at diet, look at fluids, how much fluids, dehydration can cause this. Make sure you get a variety of foods, the full rainbow, and then all the various yoga practices. But particularly, there's a algae-based EPA and DHA, which are omega-3 fatty acids that our body doesn't make, we need to take from our diet. We've grown up on a diet very heavy in the omega-6s and 9s, and so that can help, again, restore flow to the entire body. It's a matter of flow and relaxation.
You know, one thing I'm noticing restless leg syndrome must be a status symbol. Most of the people, I see must be a new diagnosis. And most of the people I see restless leg syndrome, there was some kind of status in the society. Don't ask me why, but that is my observation.
This is our last question that we're going to have time for tonight. Who is doing the best research today subjecting Ayurvedic remedies to Western clinical trials? And are there any remedies that should be tested that have not been yet?
Well, I just want to tell a brief story before Dr. Sarkar speaks to this, but I went to India looking for herbs to restore and rejuvenate the body, separate from Swami Satchidananda ahead of his visit. And I didn't tell him what I was doing. I was going with a friend who had a grandfather who was an Ayurvedic doctor. I walked into South India where Swamiji was giving satsang, and he was speaking in Tamil, and he looked at me and he just switched to English. He said, "You don't have to go all around looking for herbs to rejuvenate the body." He said, "Just bring your awareness to the third eye and every cell in your body will rejuvenate." And then he turned back to Tamil again. And I hadn't told him what I was doing, but word for word, that's it. So I think that's the essence of Ayurveda. I think Dr. Sarkar would agree, is spiritual practice.
See, the Ayurveda, the word itself, Ayu means longevity, Veda is a knowledge. Every cell in our body has a consciousness, intelligence, and a healing power. Ayurveda, by all the remedies, it taps that healing power of the cell, which causes, first called a Rogir Chikitsha. Rogir Chikitsha means treatment of a disease, then it's called a Shastharokha, maintenance of the health. I'm very interested about research in Ayurveda. I'm very updated on this. And just to share you with just 30 seconds, we had a researcher here last March? September. No, she's coming. But she was when she was here. She was here last October. Okay, we had a researcher of the world famous yoga therapy researcher named Shirley Tellis. She came here last year
To Yogaville.
Yogaville here. She gave a talk. She'll be coming again next year.
September 14th weekend.
September
Remember the date.
14, 2018. So I went to visit her. She had the largest yoga therapy research center in the world.
700-bed hospital. We only have 400 in Charlottesville.
So, but what she has, this is a Swami, his name is Swami Ramdev. Swami Ramdev has a huge follower. He's actually yoga therapist at 24/7, and he has a tremendous income today. And a large income, he put it in the research and told Shirley Tellis, you have a blank check. She has 12 people working under her in yoga therapy. Shirley says, this is nothing. Come with me, let me show it to you. She was not there. One of her associates took me. He has developed the largest Ayurvedic research center in the world. Most updated, as contemporary as can be. And me as a Western trained physician, I was surprised that much of research going on in Ayurveda. And today, the Prime Minister of India, who is very pro-Ayurveda, pro-yoga, has developed a separate ministry called Ayush. The first one stands for Ayurveda. So they are doing all the research. India has the highest number of funding for Ayurveda research, and a lot of Ayurvedic papers are coming.
So that hospital is dedicated to only 3 interventions: Ayurveda, naturopathy, and yoga. In their 700-bed hospital, they're doing research and treatment. So also we'll say Amala has helped put together this conference, September 14th next year, and Dean Ornish is coming, and it's going to be a real event here. So please come and join us.
Yeah, thank you for putting that shout out to everyone because I think it's going to be really, really exciting. We're wanting to bring together a different representation with insurance companies, hospital administrators, yoga therapists, researchers, academia, people that represent spirituality. I don't know if I said that already or not. And I think it's just going to be a really, really fantastic conversation and dialogue about how to move forward with yoga as a basis for health and wellness in our culture, in our society, in our hospitals, in our insurance system. So I think it's going to be fantastic. So save the date, September 14th, 2018. And I also want to just mention real quickly that Sri Gurudev's cousin, who lives in Coimbatore, his first cousin started a nature cure hospital many, many years ago when he had some stomach problems and he could not get any relief. And so he began to study naturopathic remedies and was able to heal himself with these naturopathic remedies, started this nature cure hospital, and his son, Ramaswamy, now has brought it forward into an amazing, I think, a world-class hospital. I was there a couple of years ago doing some programs, and businesses from all over India send their people there, their employees there, to have like a rejuvenation time, and the company pays for them to go there. And now, recently, Ramaswamy is going to be building an addition to that hospital a little bit outside in the country and wants it to be literally world-class facility in naturopathic medicine. So it's kind of exciting. And I believe, if I'm not misspeaking, that he also wants to have a university component where people can be trained in that arena also. So it's happening all over the world. It's just a really, really exciting time.
I don't know about you, I feel hopeful. Thank you so much for this wonderful and inspiring evening. When we look at the situation in American healthcare, you can feel a little bit discouraged, should I say? But when I listen to you and what's happening in this field of marrying the ancient art and science of yoga and Ayurveda with all of the brilliant research and all of the brilliant functions of Western medicine, I feel hope. I feel hope. So thank you all so very much.
I just want to mention one thing for those of you who are interested. Academic centers all over this country are doing research in mindfulness, yoga, meditation, all of these kinds of things. And one particular university system that just is absolutely stellar is the University of Wisconsin in Madison, Richard Davidson's work, Center for Healthy Living, Healthy Minds. Just amazing research coming out of that facility and everything from yoga to mindfulness. They also offer free curriculum that they've developed and researched for K through 12 schools. So you can go online, download the curriculum, take a look at their whole concept around mindfulness and implementing it in school and academic settings. So many things going on. It's such an exciting time. I hope you can jump on board with it in whatever way speaks to you.
And I'll just put a final plug into the DVD called Living Yoga, because much of what we talked about tonight, it's available at the front desk.
Great. Thank you.